Anemia remains a silent but deadly threat among pregnant women and children, underscoring the urgent need for intensified action by relevant stakeholders to ensure the adequate provision of multiple micronutrient supplementation (MMS) for healthier lives. This formed part of the discussions amongst various speakers at the 3-day capacity building on strengthening media role for anemia prevention in Nigeria, organized by Civil Society Scaling Up Nutrition in Nigeria, CSON, held in Abuja. Correspondent Abiba Dauda completes the report.
Delivering his welcome address, the Executive Secretary of CSON, Mr. Sunday Okoronko, described the role of the media in addressing health issues such as malnutrition, particularly anemia, which majorly affects women of childbearing age and children. He added that women and children often lack the avenue to speak for themselves, making the media a vital voice for the most vulnerable, adding that by amplifying both the challenges and solutions surrounding health issues, especially anemia, the media needs to match their words with actions in ensuring that their voices are heard.
If you really look at the numbers, it means 6 to 7 women out of 10 women in the country are anemic. And it's challenging because for a woman who is anemic, the possibility of that woman losing her life during childbirth is very high. And also the possibility of her giving birth to a healthy baby when it comes to looking at the nutritional status of the child she's going to give birth to is also very high. It's high that she may likely give birth to a low birth weight baby, which means that that child at birth is already malnourished, and attention is required to be able to save the life of that baby.
Also speaking, the Senior Communications Officer of CSON, Lillian Okafor, described the training as a call of action where editors, producers, and storytellers bring unique voices and platforms with a shared national narrative for anemia prevention.
And I'm grateful for journalists that are seated here and that your first and initial responses, came tilted towards what solutions journalism is. So, the essence of this session is to get us to move from writing about obituaries of pregnant women to writing to prevent those obituaries.
She, however, noted that the fight against anemia will not be won in the hospitals alone, but also in the newsrooms, digital spaces, through human angle stories with public understanding and policy decisions. Also in his presentation, the Communications and Campaign Manager of CSON, Mr. Peters Olushola, stated the objectives of the training, which include strengthening journalist capacity to produce impactful, evidence-based nutrition and anemia-focused stories that inspire action among policymakers, relevant stakeholders, and communities.
It's possible there's a supply gap. Also, there's a delivery. So even when the supply comes, the logistics, it's possible that there's a break there, there's a gap there. For you to be able to report on anemia successfully, you must have then one story or multiple stories without really tracking exactly what is happening.
Also in his presentation, Mr. Geoffrey Njoku focused on strengthening media reporting on nutrition and anemia through human-centered storytelling and urged journalists to adopt ethical, solution-oriented and people-focused reporting approaches to improve public understanding of nutrition and public health issues.
That's what I'm talking about story mining right now, because data is just data.
A representative of the Federal Ministry of Health and Social Welfare, Assistant Director in the Nutrition Department, Mrs. Helen Achimugu, presented an overview of Nigeria's nutrition landscape with emphasis on micronutrient deficiencies and anemia among women and children.
This micronutrient, I don't know what it is. The next thing we are going to look is that we are saying micronutrient is they are essential minerals. So what are the deficiencies? What does it cause when these micronutrients are deficient in our body? It leads to malnutrition. Malnutrition is referred to the deficiency or excess. It's not just deficiency. It's not just that you don't have it. If you even overeat this micronutrient, it won't work in your body. So it's two-way thing, it's two coin. If you have it, if you are eating micronutrient, it should be at appropriate amounts. If you take over, it won't do what it's supposed to do in your body.
The workshop brought together journalists and media professionals from across the country as part of broader efforts to enhance accurate, responsible, and impactful reporting on nutrition and anemia in Nigeria. Highlights of the intensive 3 days workshop includes group works from the participants, presentation of certificates, and group photographs. Abi Badauda reporting for NSTV News.